Hello, my name's Leah Morgan. I'm the Living With and Beyond Cancer Project Manager based at Shrewsbury and Telford Hospital's NHS Trust. I'm pleased to be here to present our initiatives for providing support and resources for people affected by cancer for the category of personalisation of care. I came into post 3 years ago to continue the work that was already underway at SATH to improve services for those living with and beyond cancer. There is an ever-growing population of people living with and beyond cancer. Currently in the UK there are approximately 2.5 million people, and this is set to rise to 4 million by 2030. In Shropshire, Telford and Wrekin alone there is an estimated 50,000 people living with and beyond cancer, and this is going to continue to rise. I'm going to hand over to Jessica Greenwood in our first video, the lead cancer nurse at SATH, who will explain a little bit more about our initiatives that we've been developing to empower and enable people with a cancer diagnosis.
Hi, I'm Jessica Greenwood. I'm the lead cancer nurse at the Shrewsbury and Telford Hospital NHS Trust. Really delighted to be in the finals for the Personalisation of Care Award with the Patient Experience Network. Personalisation of Care is something we're extremely proud of at the Trust and have worked tirelessly over the last 8 years to improve for people with cancer. One of our achievements which we're proud of is our Living Well with Cancer passport, designed for personalising care for all patients diagnosed with a cancer at any stage in their journey. We've also developed Living Well sessions to support people with cancer, and we offer them in the community as well as at the Trust. We've worked with our patients to develop services for patients. Our sessions are delivered by patients, and we've used the feedback we've got through developing a network of patients to develop our services. We're really lucky to have the support of our patient group, and we're really proud that we have been able to share our work with other hospitals and trusts to develop in their area. What we've done is to make sure that all of our services can be rolled out to other trusts nationally to support people with cancer up and down the country.
All of the initiatives have involved patients from day one. This was our main focus at the start of this project and remains to be as we continue to improve the resources and services through feedback we receive. We worked with a lot of different healthcare members from different services and teams to develop the passport, but we ensured that this was alongside getting feedback from patients and their loved ones every step of the way about what content they wanted in the passport, what information they wanted, what services did they want to know about, did they want local or national information, or both. We wanted to make sure we built the passport around what mattered to the people that would be using it on a regular basis. Colin, a patient representative on the Living With and Beyond Cancer Programme board at SATH, talks now about the passport and Living Well sessions in a little bit more detail and about why he got involved in our programme.
Hello, my name is Colin and I'm a former cancer patient of the Royal Shrewsbury Hospital. A couple of years ago I answered an advert for former patients to tell their story about their experience. I met the Living With and Beyond Cancer Programme team, told my story, listened to their vision, and I was totally hooked. There had not been anything like this when I went through treatment, so I instantly knew how important the programme would be to people currently going through diagnosis, treatment and beyond. I struggled through my recovery with so many unanswered questions and limited support for those what if and how can I moments. I now help to present the programme both on and offline, with over 300 people attending so far in the short time we've been going. The sessions have evolved through listening to what people were saying and what they needed, and also from the feedback given. So the programme now is totally patient focused. I was also asked to join the programme board, which oversees the whole programme and all the developments that go along with it. I am one of the 2 patient reps on the board. An interesting and innovative part of the programme is the development of the My Passport to Living Well. This was put together with the help of patients, with the patients in mind, and is an absolute goldmine of information. In it there is information which is designed to help them through their cancer pathway. It's tailored for the individual by having space for personal and shared information, so appointments, treatments and individual notes pages can be carried between different clinics or can just be used for reference, but all in one place. The passport also includes information with the patient's local area, such as support groups, information helplines, and also a national help. In brief, the passport is developed into a self-help guide for individual patients, allowing them to identify what they want or need and record this in their own record. I recently had the privilege of attending a Teams meeting with Matt Trimmer, who is the Macmillan Director of UK Partnership and Strategy Delivery. I felt so positive about our programme that I have passed on everything to him, in the hope that all our hard work can be replicated nationally, with minor local changes and therefore reach more people who would benefit from the programme. Watch this space.
The Living Well sessions have continued to be successful, even though we had to change to an online platform in response to a global pandemic. The face-to-face sessions have proved to be successful through 321 people affected by cancer attending over the 11-month pilot in 2019. The model is versatile and discussions were underway as to how this could be delivered by other community teams. The passport is used within all specialities and is given to every patient at time of diagnosis, so they are able to refer back to it, as Colin described in the video. The Cancer Care Navigators are pivotal as they provide people with personalised care and a constant point of contact. We are proud to say that the passport has been recognised by other long-term conditions as a useful resource that could be adapted to meet the needs of their patients. Let's hear from Karen now, who talks a little bit more about her role of Cancer Care Navigator for the breast team at SAF.
I am Karen Kess, the Breast Cancer Navigator, and my role is to support patients living with and beyond cancer. My main role is to be a point of contact for patients who are having problems or any concerns or questions during and after the treatment. They will call me and then I will direct them to the appropriate service that I feel would best suit their needs. I carry out holistic needs assessments, commonly known as HNAs, with the patients just after diagnosis and then following treatment to make sure that we are supporting them in every way we can. If at any point after that as well, if they ring in with a problem, they call me and then I will pass them on to the appropriate team to help them. At the moment, the breast team are trialling an opt-out version of the Living Well sessions where we send out designated appointments and then the patients can call in and say, well, what is this for? And I can explain it to them, and if they feel that's appropriate, they will attend. But I always encourage the patients to attend because I feel it's important for them to talk to others who are going through similar and they know exactly what the patient means. So I found the Living Well sessions an excellent resource for all of our patients.
A fantastic service that is available for people to access at any point is the Macmillan Information Support Centre. We're going to hear from Jessica Brindley, the Macmillan Information Support Centre Manager, who'll talk about how our initiatives have benefited the people that she has spoken to within her service.
Hi, my name's Jessica Brindley and I'm the Macmillan Information Support Manager at the Royal Shrewsbury Hospital. The Passport is a one-stop shop booklet of information on services available, and it includes information on the Macmillan Information Support Centres across both hospital sites, here in Shrewsbury and in Telford. It supports patients and their families by being just one booklet with lots of information rather than several leaflets and information that getting quite confusing and overwhelming. It's a local directory that they can refer to again and again, and I know it helps people feel more informed and in control at a time when things are feeling quite out of control. There is a section where they can add their own notes, and this makes the passport really personable because it means that everything that's in that passport is really about them and their treatment journey. So they can keep referring it back to it again and again, appointment after appointment, whether that is in primary care or secondary care. The Living Well sessions also enable patients to get local information on the 4 most common areas of concern. Patients get to meet the staff in each of the services, and this opens the door for them to access services. It helps them to feel more supported, and I know that when people come to the Macmillan Information Support Centre, they know they're coming here for a listening ear, for more information and to signpost for other services that are local to them. Helping people to navigate through a time which is often really confusing and overwhelming is really important, and the Living Well sessions really support patients. It offers them an opportunity to talk and share about their experiences. It makes the sessions really personalised to their experience. No 2 sessions are the same, and patients bring up different topics time after time, and there's always support available from all the professionals in each of the sessions.
We believe that all of the elements of our work optimise personalised care for people affected by cancer. We're really proud of our co-productive working with patients to improve the services and resources available. Thank you for listening. I'll hand over for questions.